Hello, my name is Wendy Lamberti, and thank you for being here today. I've created this report and presentation to share an important policy discussion comparing bariatric surgery with Ozempic and other GLP-1 medications for the treatment of obesity. Having experienced obesity all my life, I know firsthand the physical, emotional, and financial toll it takes. I've undergone bariatric surgery, tried multiple diets, and even followed intermittent fasting. And like 80% of bariatric surgery patients, I eventually experienced weight regain, a frustrating and all too common outcome. Now, I'm seriously considered what many have called the Ozempic train. With growing clinical evidence and real-world success stories, it's becoming clear that long-term weight management may finally be achievable with GLP-1 medications without the risk and limitations of surgery. This presentation blends clinical data, economic insights, and personal experience to advocate for a smarter, more equitable approach to obesity treatment in Ontario. Welcome, and thank you for joining me today. We're here to talk about a bold, forward-thinking proposal, one that could reshape how Ontario addresses one of our most urgent and costly health challenges, obesity. Today, I'll introduce a solution that is not only clinically effective, but also cost-efficient, publicly covering Ozempic as a modern medical alternative to bariatric surgery. Let's explore how this policy shift can improve lives, reduce healthcare costs, and bring us closer to a more equitable system. Obesity is a chronic disease. Obesity is not a matter of willpower. It is a complex chronic disease recognized by leading health organizations, including the WHO, the World Health Organization, the Canadian Medical Association, and Obesity Canada. Like diabetes or hypertension, it requires long-term, evidence-based medical care. Bariatric surgery versus Ozempic, the clinical impact. When comparing bariatric surgery to Ozempic, the differences in clinical impact are clear. Bariatric surgery leads to a substantial weight loss, typically 25 to 30%. However, it's a major surgical procedure that comes with a long-term recovery period, potential complications, and often lifelong nutritional management, plus 80 to 90% of bariatric patients regain the weight. In contrast, Ozempic, a GLP-1 medication, delivers 12 to 15% weight loss on average. It's non-invasive, has mild, manageable side effects, and improves key health markers like blood pressure, cholesterol, and insulin sensitivity. For many patients, Ozempic represents a safer, more sustainable path to better health without the risks associated with surgery. To sum up the clinical comparison, bariatric surgery is more invasive with greater complications. Ozempic is gentler on the body while still offering meaningful weight loss, metabolic improvement, and long-term weight management. Patients using Ozempic lose 12 to 15% of their body weight on average. These benefits aren't just cosmetic. They translate to improved mobility, better metabolic health, and reduced risk of progression to type 2 diabetes. Now consider Ozempic or Wegovy. A full 2-year course of Ozempic costs $10,800 per patient. Treating 2,500 patients would total just $27 million, saving the province up to $18 million annually. Let's take a look at the financial impact. Bariatric surgery costs the Ontario healthcare system approximately $45 million a year, based on 2,500 surgeries at an average of $18,000 each. Now compare that to Ozempic, A full 2-year treatment course costs about $10,800 per patient, totaling $27 million for the same number of individuals. That's a potential annual savings of up to $18 million, money that could be reinvested into preventative care, support programs, or expanding access to treatment. Ozempic isn't just medically effective, it's also a fiscally responsible choice. When we look at long-term outcomes, one of the biggest challenges with bariatric surgery is weight regain. While patients often lose weight rapidly in the first year, many begin to regain weight over time, sometimes significantly. In contrast, patients using Ozempic tend to maintain more stable and sustained weight loss, especially when the treatment is supported by medical guidance and lifestyle changes. And importantly, new evidence suggests that long-term survival rates are comparable between both approaches, making Ozempic a less invasive but equally promising long-term solution. This graph illustrates weight regain trends. Bariatric patients often regain weight after the initial drop. In contrast, Ozempic patients maintain a more stable weight loss, continue with maintenance, especially with continued medical oversight. The obesity crisis in Canada is growing. As of 2011, 4.6 million Canadians were classified as obese, with another 5.6 million overweight. The highest rates are in regions also struggling with higher unemployment and lower income, highlighting the clear link between poverty, food insecurity, and obesity. Long-term survival. Both treatments improve long-term survival rates, but Ozempic achieves these benefits without the surgical risks. It's a lower risk, lower cost path to better health outcomes. This graph highlights long wait times for surgery, between 21 and 34 weeks in Ontario. In that time, patients may continue gaining weight and developing new health complications. There continues to be a rise in bariatric surgery in Ontario, and between 2006 and 2014, bariatric surgeries rose by 300%. In the 2013 and 14 alone, over 6,500 procedures were performed, reflecting rising demand and limited non-surgical options. Who is the typical bariatric patient? The average bariatric patient is about 45 years old. They've often tried multiple diets over their lifetime and tried exercise as well, without lasting success. Most have a BMI of over 40, also with other conditions like diabetes and hypertension. Obesity affects 1 in 5 Canadian adults. Let's break down the enormous true costs of bariatric surgery. A hospital stay in Ontario can be up to $6,000 a day. Surgical fees across Ontario total around $1.7 million annually. Implants can cost $2.3 million. Add in anesthesia, diagnostic testing, and follow-up care, the total per patient costs can exceed $200,000. Economic rationale. Obesity costs Canada over $7 billion each year. But for every dollar we invest in treatment, we save $2 to $4. Medical treatment lowers hospitalizations, diabetic care, cardiac events, and disability claims. I are asking Ontario to treat obesity like the disease it is. That means adding Ozempic and other GLP drugs like Wegovy to the Ontario Drug Benefit Formulary, launching a pilot program and ensuring fair, equitable access for everyone. To recap, our proposal is clear and actionable. We're calling for 5 key steps. 1. Recognize obesity as a chronic, treatable disease. 2. Add Ozempic to the Ontario Drug Benefit Formulary to ensure accessible, evidence-based care. 3. Support the Canadian Agency for Drugs and Technologies in Health, the CADTH, in completing its review of Ozempic for obesity treatment. 4. Launch a provincial pilot program to evaluate real-world outcomes and cost-effectiveness. 5. Promote equitable, stigma-free access to obesity care for all Ontarians. Together, these actions will help modernize obesity treatment and improve lives across the province. In conclusion, obesity is a serious and complex disease, and it demands serious, forward-thinking solutions. Ozempic represents a safe, effective, and scalable alternative to surgery. By publicly funding Ozempic or Wegovy in Ontario, Ontario could save up to $18 million annually, while improving quality of life for thousands of its residents. This is more than a policy adjustment. It's an opportunity to modernize our healthcare system, reduce long-term costs, and promote equity in access to treatment. To learn more about the ongoing review of obesity treatments by the Canadian Agency for Drug and Technologies in Health, the CADTH, and how it impacts public access to medications like Ozempic or Wegovy, please visit the following link below. Your support and awareness can help drive change in how we address obesity across Canada. Thank you so much. My name is Wendy Lamberti.